The public health problem. Depression is the most prominent form of mental health illness in elderly adults. Therefore, depression is the most concerning public health issue in elderly adults. There are also a limited amount of mental health services for elderly adults, which causes a disparity in care access and poor health outcomes. Common issues and health outcomes of elderly adults living with mental health issues include isolation, anxiety disorders, dementia, sleep disorders, and psychosis. These symptoms can vary for elderly adults. In younger patients with mental health illness, a common symptom may be crying. However, in elderly adults, common symptoms include physical pain, irritability, and cognitive impairments. Poor mental health can result in various public health issues, including poor intra and interpersonal relationships, economic issues, and substance abuse. The stigma surrounding mental health in the elderly population causes people who are suffering with poor mental health to avoid seeking help. This stigma tends to be prevalent from people born before the 1960s. The importance of the public health issue. Erasing the stigma is pertinent to relieving this public health issue. By erasing the stigma, elderly adults can achieve good mental well-being and live happier lives. By erasing the stigma, we can give elderly adults a sense of self-worth, even if they are suffering, which can encourage them to seek care. Ensuring that elderly adults can get proper insurance to have longer doctor's appointments to address all their health concerns. This would promote the general well-being for this population. The integration of public care providers to also cover mental health concerns will promote better mental health. Ensuring that elderly adults can efficiently perform daily activities, maintain independence, and have the best quality of life. It is important to be able to diagnose more people in order to treat more people. Elderly adults deserve to be happy and healthy with affordable and attainable treatments.
The two main target populations to help end the stigma in elderly adults are middle-aged adults and the elderly themselves. Middle-aged adults are targeted as a preventative method. This helps tackle the issue early on, therefore lessening the stigma as they age. In addition to this, middle-aged parents can end generational stigma by having a conversation with their younger children regarding the topic. Elderly adults are the main target population. This is a way to tackle the issue from its source. Openly discussing the topic spreads awareness in the audience most affected. This is important because it allows the main target population to recognize the services and programs available for their use.
The population of aging is rapidly increasing according to the World Health Organization. Between 2015 and 2050, there is expected to be an increase in elderly adults above the age of 60, going from 12% to 22% of the population. As many as 1 in every 5 elderly adults experience mental health concerns. These individuals typically do not seek help that they need due to the stigma around it. When left undiagnosed and untreated, the mental health illness has serious implications on their lives as well as their family members' lives. Our healthcare system is not adequately helping our older adults in our community with their mental health disorders. Medicare only covers about 50% of mental health problems compared to the 80% it covers regarding physical health problems. Researchers estimate that up to 63% of elderly adults with a mental health illness do not have the access to the services that they need. The risk of suicide is still present in elderly adults due to their mental health illnesses. Individuals over the age of 85 have the highest rate of suicide, with the age group of 74 to 84 having the second highest. Suicide in elderly individuals are also more lethal compared to any other age group. For those that are above 65, there is 1 successful suicide per 4 attempts. For those in any other age group, there is 1 successful suicide per every 20 attempts. The healthcare system is still failing our elderly adults with mental health problems. 75% of those who have committed suicide have in fact visited a primary care physician within a month of their suicide.
Target risk factor of elderly adults with mental health stigma. There can be many risk factors for mental health problems at any point in life. Mental health not only affects your mental state, but has impact to your physical health as well. Older adults may experience reduced mobility, chronic pain, frailty, or other health problems for which they require some form of long-term care. These are just few of things that can affect these adults, leading to more stress, which could ultimately lead to isolation. These types of citizens are more likely to be abused. Statistics shows that 1 in 6 elderly people experience elder abuse, which could also lead to serious, sometimes long-lasting psychological consequences, including depression and anxiety.
What we expect to accomplish with our PSA is for families, caregivers, and other healthcare workers working with elderly patients is to be aware of the elderly's behavior or mental health.